I'm from East Kazakhstan, Semey region, which in that region for 50 years a lot of nuclear bombs was tested, and many people have problems with cancer. And we have like 8-9 different types of data that we are trying to combine and to build a multimodal predictive model using like AI models. It will assist doctors on decision making. Kazakhstan is not only Astana or Almaty. Yes, we have regions who should have also good quality of services, and our solution, I think, will help them in coming future.
Breast cancer is one of the most insidious oncological diseases. It is the leading cause of death among women with cancer. According to the World Health Organization, around 2.3 million new cases are diagnosed worldwide each year. The statistics for Kazakhstan are also alarming. Breast cancer can develop silently without noticeable symptoms. This is why many women seek medical help too late, when the disease has already reached its final stage. If breast cancer is detected early, the chances of a full recovery increase significantly. Combined with modern treatment methods, this approach offers an opportunity to save patients' lives. Kazakhstani scientist Beibit Abdikenov's goal is to create a system that can detect breast cancer in its earliest stages, using artificial intelligence to make this possible.
We are trying to collect different types of data for breast cancers, for example, mammography, ultrasounds, computer tomography, magnetic resonance data, and also some genetic data, biomarkers, table data, and some text data. Based on these different data, we are trying to identify is there any cancer. For example, some data is in form of image. On image, we are trying to find the lesion. Is it small or big, and we do some kind of segmentation. And for other type of data, for example, for table data, we are trying to get the information about the patient from the electronic health record, and based on that we find the age, then gender type, does the mother have the breast cancer or not, some other features of the data. Then also we have some kind of description of that data. For example, same type for example for images, there is a description of the image. When the doctors, radiologist writes the description, we also analyze that data. At the end, we have like 8-9 different types of data that we are trying to combine and to build a multimodal predictive model using like AI models, especially like some deep learning algorithm. And what that gives is it will help us predict. First of all, it will help us diagnose that is there any cancer or not, especially breast cancer. It will assist doctors on decision making. When you have like combined different data, especially when for one patient you have many different types of data, that's good, and it will give you more. It will give you, how to say, more precise description.
About 40 specialists from various fields are involved in the project. This consortium brings together a university where scientists conduct their research, the Institute of Oncology and Radiology, the Institute of Genetics and Physiology, the Oncology Hospital in Astana, and the Ministry of Health of Kazakhstan. All these organizations are working together toward a common goal, achieving real progress in the early detection of breast cancer. The team aims to present their findings by 2026.
What is unique in our research, we are trying to gather nine types of data for 2,000 patients. I mean, every patient that we are going to involve in this study will have all types of data. Currently, we write that it will be 2,000, but hopefully, if it's possible, we will try to increase up to 5,000. That will be unique because there is some institution, if I'm not mistaken, Stanford is collecting their own database, but that database is not open, and some data is available only for one types of data. But what we do is that we are trying to find all types of data for one patient, and that will be one contribution. Second contribution is a technical. It's in terms of, for example, labeling. In machine learning, in order to machine understands that something is image, what is in image, first you should give them a lot of data. Yes, for example, basic thing I want to classify, there is a dog and cat. Yes, now I should put into my model or algorithm many photos of cats and dogs. Then I should put in the photo some squares. Yes, we call it like labeling the data. I should write this is cat, this is cat, this is dog, and I have a huge data. Then model will learn on that and take a decision. If you come to the medical part, it's very expensive label the data, because it takes a time of doctor or radiologist who can treat the patient at the same time instead of sitting and labeling my data. Yes. From this point, we are trying to build an algorithm that can train on very small sample of data. Third thing, what we are trying to do is combine the image data with text data, and based on that, make a better decision. I mean, this is our main contribution.
Mostly people try to work with the images, and they do image analysis and then do predictions based on those image analysis. But what is unique in his work is that he's also, apart from the image data, he's also collecting many other kinds of data, like reports from the radiologists and expert knowledge, and putting everything into one big model can actually make difference. It can make this kind of model more explainable and more robust.
Beibit Abdikenov has been researching data storage and forecasting for over 10 years, dedicating both his master's and PhD thesis to the field. His initial idea was to use animal movement to predict earthquakes in southern Kazakhstan. He proposed placing sensors on animals to track mass movements and identify patterns linked to seismic activity. However, the project turned out to be too ambitious for a single dissertation. So he decided to apply his expertise in medicine, where his research could significantly aid in the early diagnosis of serious diseases.
I am from East Kazakhstan, Semey region, which in that region for 50 years a lot of nuclear bombs was tested, and many people have problems with cancer. I mean, it's the highest number in that area, and in like not my close relatives, but some relatives, some friends, mothers or other people have an issue. In every family you can find few people. And that was actually the main thing why I chose this topic. I hope by the end of the project we will be able to integrate our solutions to our hospitals, and especially regional hospitals will benefit from them, because we have a lack of good expertise in the regions. Not only because Kazakhstan is not only Astana or Almaty. Yes, we have regions who should have also good quality of services, and our solution, I think, will help them in coming future. We are going to publish our results. We have we planned almost 23 publications, 11 of them all of them will be in international journals with a high impact, and everyone can see our results. They can read our results, and that will be available worldwide to everyone. And that's the thing.
As a child, Beibit Abdikenov never imagined he'd become a scientist. After graduating from university, he worked as a software engineer and business analyst in a company. But after a few years, work was generally becoming more routine over time. He realized he needed a real challenge, something he could dedicate the next 10 to 15 years to and truly master. That's when he decided to dive into science, focusing on data collection and forecasting. His family supported him on this path, helping him pursue his new goal.
Most of the time, I work like 6 days per week, like 10 or 12 hours. But I always try to have a dinner at home with my family, or with mother, wife, and daughter. And another thing, I always try, with me and wife, we always try to make a walk at evening. That's the gold rule, which one I will not cancel. Whatever happen, even it's 12 night, 2 o'clock at night, we will do always walking. That's the rule. Every day in science is a challenge. There is no that one thing is big and small thing. All these steps is a challenge. Every day is challenge because every day you solve certain problems. Some is small, but some is big. But as a whole, it's a big challenge which you want to change. This is why I choose science, because it's challenging. I have a few choices when people advise to me to become a vice provost in some university in regions. Provost, it was to become a vice provost in few universities. There was a choice. No, I didn't want to go there. Also, to become a head or director in some government stuff. No, because it's my choice.
The scientist believes that Kazakhstan has great potential for scientific development. Given the country's location and resources, he sees promising opportunities in agriculture, logistics, and of course, artificial intelligence, especially in software development. Kazakhstan has a strong tradition in mathematics, and talented mathematicians can make a valuable contribution. But to achieve results in any scientific field, persistence and discipline are essential, he says.
There is a book about Henry Ford. I forgot the name of the book. My Life. I think I can advise. It's a good book. And second, now I'm reading that fancy book. It's called Atomic Habits. Small habits that will change. The idea is that everyday discipline and small habits will change your life. My motto is, whatever is done in this world, if you can find a single scientific paper on this area, definitely you can do it. It's an only matter of time, matter of patience, and matter of money, yes? But you can repeat and you can do the same thing. It's achievable. Even no one did it in this world, you can try it. The bad thing will be not bad thing. The result will be you can fail or you can achieve something else. And there is no limitation. There is no limitation in size. There is no limitation from your imagination point of view.
Dr. Abdikenov is driven not only by the thrill of discovery, but by a vision to inspire others to follow a scientific path. For him, creating opportunities for those who want to enter the field and helping young researchers realize their potential is essential. He believes that the future of science in Kazakhstan largely depends on those who bring fresh ideas and energy into it.
I know Beibit for almost 8 years. And I know him I first met him when he was a PhD student, and that time we founded together Public Association Young Researchers Alliance. So I know him mostly from this part of his activities, not only as a researcher, but also active in social life. And this organization is one of the biggest in Kazakhstan, we can say, and we have about 300 early career researchers across Kazakhstan and worldwide Kazakhstani people. And in 2 months we found a sponsor as well, social fund, but we actually managed to do it, and we made a system, we made the process, how they apply, what kind of system should be in place. So when he first shared with us his idea, most of us didn't support him, and we thought this is too much. It sounds like too much for a small organization. This something has to be done by someone else. But once we started, we continue it for almost 7 years. We continue supporting our undergraduate and now graduate students as well with these projects.
Timely diagnosis of breast cancer is a top priority in medicine. In its early stages, the disease often progresses without symptoms. Traditional methods such as mammography do not always detect the disease this early. Scientists worldwide are developing new technologies, including artificial intelligence, to make diagnosis faster and more precise.
For now, we are planning to have some international collaboration, especially myself have some collaboration we have some collaboration with different universities. For example, with Gazi University from Turkey, we had some collaboration. There is some professors from Australia, University of Canberra. We have a collaboration, and from my PhD professor, my supervisor from my PhD, he have a good collaboration with University of Leeds. Through him we can contact them, and I had a professor Bara Jasani. He was my co-supervisor. He's working in Germany in industry, who is working in this cancer field. He's oncologist, and we are trying to get with German through him. I think we can get good collaboration. Nowadays, most of the projects are multidisciplinary. For example, in our case, in our team, we have researchers from diverse fields. Especially, we have oncologists, we have specialists from genetics. For example, we have some specialists from biology, we have computer science specialists, we have some mathematics, and each of them do their own work, and they are responsible for certain tasks. And only combination of these works, when they come together, this way we can achieve the results. We always consult, and each member responsible for specific tasks, and we always ask expertise from that specialist. For example, first of all, when you label the data, we need the doctors, oncologists, then we need the radiologists who will say that in this photo there is a cancer, and they will explain what type of the cancer. Then another researchers, they will write their recommendation, and they will convert it to mathematical formulas. From mathematical formulas we convert to the code, and at the end we also test this system, and it involves different specialists who is responsible for a certain area. From this point, teamwork is important, and managing the team is also important.
Beibit Abdikenov is the face of Kazakhstani science. By 2026, he plans to introduce a unique model for diagnosing breast cancer, designed to analyze diverse data and help doctors detect the disease at its earliest stages. This AI-driven technology has the potential to be a powerful tool, providing doctors with faster and more accurate results. Abdikenov is committed to addressing one of medicine's most pressing challenges, and his work could ultimately help save and extend the lives of countless women.
My greatest achievements will not be in terms of money or some medals or some letters. Yes, it will be mainly something that will help human being. If after some years the projects will be, especially this breast cancer project, if it will be integrated and deployed into the hospitals, and that results will help us to decrease the number of patients with breast cancer, or another way, it will help us to diagnose in early stages these breast cancers. That will be a great achievement for me, because I can help this way, first of all humans, secondly to our country.